Good morning, everyone. Dr. Wendy Fortna here for this week's update on the COVID-19 crisis in the community and area of Hanna. Today is April 27th, for those of you who want to know, and the information that I talk about today, I can only, of course, guarantee is current as of today. I'm doing this video a little bit earlier than previous videos because we now have a confirmed case of COVID-19 in our community. Some of you know that because it's been around social media, and for others of you, this is new information. It's normal for it to cause a little bit of panic in you. I had a moment where I thought, darn, we were doing so good for so long. But all it really did was serve to say that all of the things we are doing right now to protect ourselves and our families are for a reason. There is nothing new that you need to be doing. Just carry on with the social distancing and the cleaning precautions that you have already taken. We do not have any confirmed cases of COVID-19 in our hospital, in our seniors lodge, or in our nursing home. I'd like to thank all of you who have been watching these videos and taking the messages to heart and action. Everyone's been really good about phoning up to the hospital to book an appointment for any lab or x-ray tests that need to be done. We again remind people who are bringing packages to their loved ones up at the hospital or nursing home to continue to do so at the front doors of the hospital between the hours of 8 and 4 Monday to Friday, if at all possible. Some of you have noticed there's a little bit of a longer wait time in your vehicles. Even if your appointment was 10:30, we might not go and get you until 10:40. And that's because we've implemented a very stringent cleaning policy so that every room gets cleaned between every patient, every surface that is touchable by a patient or the physician. So please be patient with us. We are doing our best to stay as on time as possible for you. I have had a whole bunch of questions this week, mostly focused on what we should and shouldn't be doing in our community in order to stay safe. I've struggled a great deal with what is enforceable and what is recommended. So I'll do my very best to let you know what is my opinion medically and what the government and what our town has decided. I received a really good question, and I'm going to read part of it to you. According to Dr. Hinshaw's press conference and the Alberta.ca website, they are recommending that social gatherings are to be limited to your own household or cohort families. I'm concerned that people may interpret your message from last week that social gatherings with friends and families are nothing to worry about as long as they fall under the 15 people and social distancing rules apply. Shouldn't we all be trying to follow and support the provincial recommendations around social distancing and gatherings, or do you feel that because we have low numbers in our area, stretching gatherings to include people outside our household or cohort family is acceptable? So for those of you who don't understand the idea of a cohort family, it was mentioned a number of weeks back in Dr. Hinshaw's posts that a family can choose to isolate in a way with another family. What this would mean is that a unit of people decide to include another unit of people for the duration of the COVID crisis as part of their small social circle. Some of the examples where this might be happening. Let's say that our family is expecting a new baby, which we are not, but if we were, I may choose to include an aunt or a grandmother as part of my social circle, meaning that she can isolate from other groups, but can still come over to my home and help me care for that baby. Another example would be the idea of socially distancing with your day home. As the very nature of a day home means there's going to be kids likely from 2 or maybe 3 families who are quite small, and those families may decide that they will spend time together but not spend time with other people outside of that bubbled group. So this question is a difficult one because it's another one where it is the difference between what's enforceable and what I would recommend. We do know that gatherings of more than 15 people are prohibited. So if you and your 12 best friends want to get together and you're able to have social distancing, it is not enforceable to stop you from doing that. What I would say is that there's great difficulty in maintaining adequate social distancing. To stay 2 meters from someone without touching the same surface, without accidentally getting closer, without sharing a food or beverage, without getting up to use the same bathroom is extremely difficult. So I would recommend people not do that with groups of people of 12, 15 people. But I'm trying to balance that with the idea that our mental health needs to have some interaction with the outside world. So for example, I take my 2 children to play outside of the manor here in Hanna so great grandma can look out her window and see them. I think that's a wonderful way of supporting her mental health during the isolation, as she's a particularly vulnerable group. I've seen a group of friends walking down the street, however they've been excellent, and there is one in the middle of the street and one on each sidewalk. A small group like that, it's a great way to maintain our mental health. I'd like to talk for a moment about the great stress that this crisis has put on our children and our teens. They're a group of people who have had the very center of their world torn apart. Their graduations, their birthdays, their school, which is the center of their life, has been canceled. It's hard to support them right now because they really want to get out and about with their groups of friends. Please try to focus with them that if they have someone in their social bubble, that's different than going to a house party where they meet up with 7 people and they're very much not social distancing. If they're struggling, or if you yourself are struggling, please contact the medical clinic and see if we can help in some way. There are also phone numbers available for mental health on the alberta.ca website, and we will list some of those in the text below this video. To summarize, what I would say in this instance is that while gatherings of up to 14 people would be acceptable, I would not recommend doing it with people outside of your cohort, also known as your bubble. The next set of questions that came up this week that was very active on social media was about playground equipment. I've had the opportunity to talk to Kim from the town, and he has assured me that town council is continuing to address the issues of playgrounds and their safety. They are at this point posting signs on the playgrounds that indicate you are using them at your own risk. They recommend cleaning before and afterwards and avoid touching noses, mouths, maintaining social distancing between you and any other people on that playground. My advice is to not use playgrounds. What is concerning is that it is very, very difficult to protect children from becoming carriers of this virus. The example I would give you is that a family goes and a child inadvertently scratches their nose and wipes it as children do, and then walks up the handrail of the stairs. They might be gone from that playground and another family comes up. They wash their hands beforehand, they touch that same handrail, and then they go home, and now they are carrying that virus. They may transmit it to their parents, to their siblings. Mom may take it to the grocery store. I'm concerned that that's a way of spreading this virus right now. It's difficult, but that would be my advice, to stay off of playgrounds at this time. I'm grateful that everyone in the community of Hanna has been so wonderfully supportive of the medical community and of each other at this time, and I continue to recommend that you do so. If you have further questions that you'd like me to answer, please pass them on to the town of Hanna or the medical clinic, and I'll do my best. Take care.